I too am supporting the motion, and I compliment the Deputy for putting it forward in the Sinn Féin Party. And I do hope that the government, this new all-embracing government meant to be, will understand this and try and support it. COVID-19 has been a very difficult time for many families, but especially for mothers who have had the pleasure and the beauty and the joy of giving birth to a baby. Many of these were unable to have the support of their partners or their husbands because of the situation around the lockdown and entry to hospitals. And the parents, the daddies and the fathers, had to wait until such time as their mother and baby were being discharged to even see that baby. Grandparents, and as a proud grandparent myself of 8 wonderful grandchildren, I know what it's like for grandparents to wait and wait and wait and wait to get to see and get to hold and embrace their grandchild. It's a very joyous and a very spontaneous event that they have when they meet their grandchild in the first days. Normally in the hospital this happens. And I mean, they have been denied so much, the parents, the mothers, and they need to be supported now. And they need to be dealt with sensitively and indeed engaged with. Many of them haven't had even the pleasure and the necessity really of having the community nurse visit and to do a check-up on the child and wait and about feeding, and just in general that a visit is very, very important to both mother and baby, and indeed the father as well, and all the other siblings. As I said, the grandparents, I've received emails from many of them. I've received emails from many mothers in this position, and it's heart-wrenching to see they not being allowed and not being supported. And indeed, the paltry amount offered yesterday, or the announcement of the 3 weeks, it's just not enough. And listen, we could find money for everything in COVID. I know there'll be payback to it, but we could find money. And I, in this seat here, really talk strongly to the Minister of Finance about the 350 payment for everybody, no matter if they worked for 2 hours or 10 hours a week. It was ridiculous, that, and it gave people a sense then of that money, and people are going to miss it terribly now when it's cut off them, and it's going to affect their college students' applications for their SUSI grants and for everything else as well. So it just was a rushed decision with no problem with the money. Yet we can't see that we could pay the mothers now 12 weeks at 12 weeks at 245. Our children are our very future. A nation is not a nation without its children, and they're the most important people to be nourished, and it's very, very important. I, as a grandparent, in 2017, we introduced an extended maternity leave for parents of premature children. At the time, I was very much welcomed this extension. My first grandchild, Amy Berry, was born at just 30 weeks and spent over 3 months in hospital. So I understand the difficulties, the stress and the worries that brings. Back then, there was no extension to maternity benefit, and thankfully this was rectified. But I said at the time that they were introducing had a lot of glaring anomalies in it, and it had, as often much legislation has, and I'm sure that will be passed this evening, will have many, or will debate this evening, will have many of those as well. Parents of premature children will get an extra week's maternity benefit, depending on how prematurely the baby was born, to help parents cope with extra hospital stays in the neonatal unit, but parents of children with life-limiting conditions, born at full term, facing the same long stays as in the neonatal units, receive nothing extra. That was an awful statement. And you would wonder, I suppose, when we saw the savage abortion regime that was introduced here last year, or in 2008, why they were thinking that way along the line. So we have to think seriously about supporting the mothers and the babies. And the mothers, and I'd probably be attacked for saying this, normally the homemakers, and they do a wonderful job. They must be supported. And I want to salute the mothers and the grandmothers, who and grandparents and other siblings as well, for the support that they give the family. There is a saying in Africa, I think it was, that it takes a village to rear a child. Well, it takes a whole family. And it's a very lonely place for a single mother, or for a mother that's away, or a mother, in this case, that was in hospital on her own. And if there was any issues, and there was delayed discharge after the birth, post-birth, it was very, very harrowing on them, very tiring on them, and obviously the fear of being in hospital as well, and maybe getting contact with COVID patients or COVID infection. So there was huge fears there as well. So I said the parents need to be supported, and both parents, and we have paternity leave now as well. And there's been often mentioned about employers, especially small employers, and especially this current situation, will find it hard to pay the extra leave. But nonetheless, I keep saying this, especially small employers, they value their staff, and it's a two-way street. The staff value and appreciate and respect them, and many amicable agreements will be worked out as well. So as I said, the parents face a lifetime of hospital appointments as well, the parents of premature babies, long hospital stays, and many life challenges that they get no such support. So while I do support this motion, I would ask that the group of parents are given this support outside of the COVID-19 temporary extension, because they need it. It isn't because COVID is here they need it. They need it more so because COVID is here, but they need it in any case. As I said, we have to nurture our youngest and our babies, and they are the adults of the future, and they are the people who will, fill up our schools and will go on to education and third-level education, and indeed run our country and fulfil all the roles. My other concerns is that one of them is that we still have a situation where over 66s have been left with nothing, and many of those are the grandparents, and we're heartless. The grandparents that want to help rearing their grandchildren, collect them from the creches, bring them home, collect them from school, bring them to sports, whatever, to support the working families and the two parents that are working, because they have to work. So I'm really think that is a very sad outcome. And remember, many of those grandparents will be called on again, and for the great-grandchildren. And that's a wonderful, wonderful thing to be able to do and be able to help in those cases. There was mention made, and it's very, very important, mental health is a huge issue, and the damage and the effect the COVID lockdown has been on people's mental health. And there's 13% of mothers who do suffer postnatal depression, and they need extra support and extra help. And the fact of they've been forced back to work now, just out of their maternity leave, that can bring on its own stresses and strains, and of course it can bring on mental health. And they've had no time with COVID until just recent weeks to be able to go out for a meal or to go for a walk with their husband or whatever, with the pram and the baby, and indeed the normal things that they do. To be so proud, the pride in their eyes and their faces, to be able to present their baby to people, to see them and meet them, whatever, and look forward to their christening and look forward to their long life together. So I think it's very important, Minister, that this be found. After all, we can find savage amounts of money to pay for an abortion industry that 6,666 babies, children were aborted last year, and we have no bother paying the money for that, and encourage more of it. So if we can't find this to support the living babies, and all the babies from the womb to the tomb should be spared, but this is a very unequal legislation, and I appeal to your better judgment to support these mothers and indeed their families.
Thank you, Deputy.